Hi everyone. So I decided to do my presentation on long haul COVID. So can your body be affected after having COVID-19? Um, COVID is not just an illness that lasts the typical 2-week infection period. There's actually a lot more things COVID is capable of that many people are definitely not aware of. Some after effects include organ damage affecting the heart, kidneys, skin, and brain, inflammation issues, immune system issues, chest pain or tightness, dizziness, and brain fog. And there are many others that can occur after contracting COVID-19. So the prevalence is the chances of getting the after effects of COVID are actually very likely. And this is a fact from the CDC that 1 in 5 people between the ages of 18 to 64 will have some sort of post-COVID syndrome, which is very interesting to me. These symptoms usually occur like a month to a year after contracting COVID. And an interesting fact from www.kff.org is that 15% of all adults in the United States actually have reported having long haul COVID effects. And along with that, 6% have reported current symptoms, which is a decent amount. So while I was like researching the web on long haul COVID, I stumbled upon these two graphs, and I thought they were very interesting because, as you can see down on the bottom here, these are like different things that affect the long COVID patients even more than what they already have. Like they increase these symptoms. So like stress is like a big one, physical activity, and then mental activity. So that's like where the brain fog is. I think that's very interesting. Lots of different things on here. And the other one over here is interesting as well. It shows like the experiences with relapses and symptom course. Um, so how does it affect the exercise response? So long haul COVID actually has been proven to negatively affect the person's capability of exercise. It lowers the individual's endurance and capability to do what their body used to do before COVID. So until symptoms begin to fade away, individuals with long haul COVID should avoid intense to moderate exercises until they are feeling back to normal. And another important piece is to actually get an EKG test done at a local healthcare facility to make sure that your body, heart, and lungs are all ready to begin exercise. How exercise affects the condition. So that's basically like what I was saying in the other slide. Exercise affects long haul COVID patients, like as well as their capabilities to exercise. So on the WebMD, I actually found this interesting fact as well. It says that 86% of adults with long haul symptoms claimed that exercise worsened their symptoms. And in addition, patients have also said that long haul lowers energy levels, so it makes it harder to complete exercise as well. And with long haul COVID, one of the symptoms is fatigue. So if exercise is making their low energy levels higher, then that's also something that they need to avoid. So are there pharmaceutical indications? As of right now, there aren't any pharmaceutical indications to lower the severity for the after COVID symptoms. The only thing would be healthcare workers are recommending are lowering exercise, like I said, resting, and of course hydrating until they feel their energies levels starting to rise, and they should not be participating in physical activity. So the actual long haul effects, there's 3 main effects, but there's definitely many more. The first one is fatigue, and then shortness of breath, and then cognitive problems, which I think this one is like the most interesting of it because it's thinking and memory. And I actually had long COVID, and the cognitive problems was my worst issue. And I would have never thought that. It was because like COVID doesn't really like attack like your head. It was very interesting to me. So these symptoms may come and go, but they will have an impact on the patient's everyday activities. Breathing is one of the biggest components that's affected with long haul and obviously should be monitored frequently. So for my case study, I actually chose one of my friends because he actually just had COVID. So my client is 23 years old and he's a basketball player, and he contracted COVID, I believe, 2 weeks ago. And he's like feeling mild symptoms. His symptoms include shortness of breath, elevated heart rate, especially while exercising, and major fatigue. So after I heard his symptoms, I would begin the exercise program very slow. And I actually probably wouldn't have him exercise for at least a week until his symptoms weaken, and then we can begin. I'll also start by at like a lower pace of intensity because, as he also mentioned that he has sports-induced asthma. So that's also like a major factor in this. Having asthma affects the breathing even more. So I'll definitely have to monitor that more than normal. And just an example to do this for other patients would be to check their heart rate periodically throughout their workout. This will help make sure that their body can withstand what we're doing, and I'm not pushing him past his limits. So for exercise prescription, um, after I've assessed his symptoms and energy levels, we'll then proceed with this plan. So for the frequency, I was thinking 4 to 5 days a week, Monday, Tuesday, Thursday, Friday, and then Sunday as a active recovery day, since recovery is very important for the body, especially with long haul COVID. So for the intensity, I'm going to start moderate intensity, maybe even a little bit lower intensity just to start. And then for the time, I'm going to do 45-minute workouts per day. I think that's very beneficial. And then for the type, it's going to be cardiovascular and aerobic. Just a little like breakdown of like the exercises and types of workouts I'm gonna have him do since he's an athlete and he has experience in the weight room. So for Monday, I'm gonna do shoulders, triceps, and chest. So we're gonna start with like chest press, shoulder press, tricep extension, cable rows, skull crushers, chest flies, and scapular elevation. And Tuesday, it's gonna be back and biceps, so bent over rows, hammer curls, one arm cable pulls, lat pull down, alternating bicep curls. And if you notice throughout this prescription, I purposely made like single arm workouts and like single leg workouts because it's very beneficial to get that connectivity between your mind and your body. So if you are focusing on one leg at a time, it connects your body and your mind to each other. Like that's one physical activity, but it's also a mental activity. And then for Thursday, quadriceps and hamstrings, so split squats, snatches, leg press, heel elevated step outs, and elevated squats. And then Friday, I wanted to include some cardiovascular activities and an abdominal workout to get his core back. And so for the cardio workout, I'm gonna have him start at around 50%, and we're just gonna work up probably to 75% and then eventually to 100. And then Sunday is an important day. He's gonna do like an hour or however long he wants to do, but an hour walk with nature and then a yoga session for recovery, since yoga is very beneficial for recovering the body. So personal experience. I actually experienced long haul COVID last spring. And so after I had COVID, I had trouble with my breathing. My main symptoms consisted of major like shortness of breath. That was my main concern, and brain fog and fatigue with exercise. So I'm on the women's soccer team here at Westchester, and I was required to run a lot with long haul COVID, and that made it very difficult. So my athletic trainer only allowed me to get my heart rate to 165, and that's solely because of my EKG results. My results were abnormal, and they did not know like what exactly it was, so they kind of just connected it to COVID. So after that EKG results, I was prescribed a breathing treatment because of the results. And that's also because I have asthma, so they were concerned about my lung function. The breathing treatment helped tremendously with my shortness of breath, and that's something I'm very grateful for. This was a difficult time, definitely, because I felt as though like I could exercise, but the doctors and athletic trainers just did not feel as though I should participate in soccer. So long haul has taught me to take one step at a time and to, like until full recovery because it's so important to allow your body to heal properly. And I'm just thankful that I had this experience, like despite the circumstances, to go through something like that. Some modifications are lowering exercises or cutting exercise altogether until they feel better. This will allow the body to rest and not put stress onto their hearts, their lungs. Physical activity could make symptoms worse, and they have been proven to make symptoms worse. And prolonging recovery. So another adaptation there can be would be to try breathing exercises to help their breathing. So actually on the lower left-hand corner, I just decided to look up a example of one. So it's like sit or stand with your elbows slightly back. That'll open up your airways and inhale a deep breath, hold your breath, and then exhale. Breathing helps overall wellness as well. And there are many things that can be done to lower symptoms and help them recover, but those are just a couple. So in conclusion, long haul COVID is a very common disease in the United States. The after effects of COVID have been proven to make this virus more serious than we thought. We're very fortunate that the heart and lung effects are mild, especially in our older population. Resting is the #1 treatment for this illness and should be taken very seriously. The CDC has been providing research projects for long haul COVID, and in the near future, I do believe there will be a cure. Thank you.